everyone, this is SWATI Jaiswal, second year September batch from University of Perpetual Health System Delta. Today we are going to do the musculoskeletal examination. For that, we will start with shoulder examination with our basic maneuvers to see if there is any tenderness, swelling or pain. Let's proceed with the video. We'll first start with inspection. Observe the shoulder and shoulder girdle anteriorly and inspect the scapula and related muscle posteriorly. Note if there is any kind of swelling, deformity, muscle atrophy or fasciculations or abnormal position. Look for any swelling of the joint capsule anteriorly or bulge in the subacromial brusa under the deltoid muscle. Survey the entire upper extremity for color change, skin alterations or unusual bony contour. Beginning medially at the sternoclavicular joint, raise the clavicle laterally with your fingers. From behind, follow the bony spine of the scapula laterally and upward until it becomes the acromion to the summit of the shoulder. Now with your index finger on the top of acromion, just behind its tip, press medially with your thumb to find the slight elevated ridge that marks the distal end of the clavicle at the acromioclavicular joint. Move your finger medially and down short step to the next bony prominence, the coracoid process of the scapula. With your finger on the coracoid process, allow the finger to fall on the grasp, the lateral aspect of humerus to palpate the greater tubercle with where the muscle inserts. Now palpate the bicep tendon in the intertubercular group. Keep your finger on the coracoid process and your finger on lateral aspect of the humerus. Examine the subacromial, subdeltoid, brusa and sits muscles. First, passively extend the humerus by lifting the elbow posteriorly. This rotates the structure so that they are anterior to acromion. Palpate carefully over the subacromial subdeltoid brusa, underlying the palpable supraspinatus, infraspinatus, teres minor, and subscapularis muscles. Now, we will move to range of the motion and maneuvers. The first, we should ask our patient to flex their hand, and then extension, and then abduction, and then adduction. Now ask the patient for internal rotation, after that external rotation, and move the hand to 90 degrees. For the crossover test, palpate and compare both joints or swelling or tenderness. Abduct the patient's arm across the chest. A patient to touch the opposite scapula using the two motion, which is known as Apley scratch test. First, we'll ask the patient test the abduction and external rotation, then adduction and internal rotation. Test of nearest impingement sign. Press on the scapula to prevent the scapular motion with one hand and raise the patient's arm with the other. This compresses the greater tuberosity of the humerus against the acromion. Test for Hawkins impingement. Flex the patient's shoulder, elbow to 90 degrees with the palm facing down. Then with one hand on the forearm and one on the arm, rotate the arm internally. This compresses the greater tuberosity against the acromial ligament. For supraspinatus strength, which is also known as empty can test, elevate the arm to 90 degrees and internally rotate the arm with the thumbs pointing down as if emptying a can. Ask the patient if to resist you. Place downward press. Test of drop arm sign. Ask the patient to fully abduct the arm to shoulder level or up to 90 degrees or lower it slowly. Note that the abduction above the shoulder level from 90 degree to 120 degree reflect the action of deltoid muscle. Do the hand examination. For that, we'll start with inspection. Observe the position of hand in motion. See if there is movement are smooth or neutral. The fingers are relaxed. They should be slightly flexed. Fingernail edges should be in parallel. Inspect the palmar and dorsal surface of the wrist hand carefully for the swelling over the joints. Note any deformities of the wrist, hand, or finger bones, as well as any angulations. Observe the contour of the palm, namely the thenar and hypothenar eminences. Note any thickening of flexor tendon or flexin contractures in the fingers. Palpate the group of each wrist joint with your thumb on the dorsum of the wrist, your fingers beneath it. Note any swelling, buzzingness, or tenderness. Also palpate the radial styloid bone and the anatomical snuff box or hyoid depression just distal to the radius styloid process formed by the abductor and extensor muscle of the thumb. The snuff box becomes more visible when lateral extension of the thumb away from the hand. Also palpate the 8 carpal bones lying distal to the wrist joint and then each 5 metacarpals, proximal middle and distal phalanges. Palpate any other area where you suspect any abnormality. Using same technique, examination the DIP joints. In any area of swelling, inflammation, palpate along the tendons inside. Hand grip. Test the hand grip strength by asking patient to grasp your second and third finger. This test function of wrist joint, the finger flexure, and the intrinsic muscle and the joints of the hand. A movement which is also known as Frankel distance test tests the thumb function of the wrist plane by asking the patient to grasp the thumb against the palm and then move the wrist towards midline in the ulnar deviation. The thumb abduction tests thumb abduction by asking the patient to raise the thumb slide up as you apply downward resistance. Sign of the medial nerve compression by tapping lightly over the course of medial nerve. Fallon sign of medial nerve compression by asking the patient to hold the wrist flexion of 60 seconds. Alternatively, ask the patient to press back of the both hands together to form right angles. These maneuver compress the medial. Let's move on to the knees. Inspection of the knees. Look for the loss of normal halo around the patella, a sign of swelling in the knees joint and suprapatellar pouch. Note any other swelling in or around the knees. Move on to the palpation test of effusion in the knees. The first is bulge sign. For the minor effusion, with knees extended, place the hand above the knees. Apply pressure on the suprapatellar pouch, displacing the milking fluid downwards. Stroke downward on the medial aspect of the knees. Apply pressure or force fluid into the lateral area. Tap the knee just behind the lateral margin of patella with the right hand. For the major effusion, place the thumb or index finger of your right hand on each side of patella with left hand compress the suprapatellar pouch against the femur. Feel for the fluid entering or ballooning into the space next to the patella under your right thumb or index finger. The patella to assess large effusion, you can also compress the suprapatellar pouch or ballotté or push the patella sharply against the femur. Watch the fluid returning to the suprapatellar pouch. Move on to the maneuvers for examination of the knees. First is Mac mirror test with the patient supine grabs the heel, flex the knees, cup your other hand over the knee joint with the fingers and thumb along the medial joint line. Form the heel externally, rotate the lower, then push on the lateral side to apply a valgus stress on the medial side of the joint. At the same time, slowly extend the lower leg in the external rotation. Abduction stress test with the patient supine, the knee slightly flexed. Move the thigh about 30 degrees laterally to the side of the table. Place one hand against the lateral knees to stabilize the femur and other hand around the medial ankle. Push medially against the knee. Pull laterally. Ankle to open knee joint on the medial side. Now for the adduction stress test with the thigh and knee in the same position. Change your position on so you can place one hand against the medial surface of the knee and other around the lateral ankle. Push Laterally against the knee, pull medially at the ankle to open the knee joint on the lateral side. Now for the anterior drawer sign, with the patient supine, hip flexed, knees flexed to 90 degrees and feet flat on the table. Cup your hand around the knees with the thumb on the medial and lateral joint. Line the fingers on the medial and lateral insertion of the hamstrings. Draw the tibia forward. Observe if it slides forward like drawer from under the femur. Compare the degree of forward movement with that of the opposite knee. Attachment test. Place the knee in 15 degrees of flexion. External rotation. Grasp the distal femur on the lateral side with one hand and the proximal tibia on the medial side with the other. With the thumb of the tibial hand on the joint line, simultaneously pull the tibia forward and femur back. Estimate the degree of forward extrusion. Posterior drawer sign. Position the patient and place your hands in the position described for anterior drawer test. Push the tibia posteriorly and observe the degree of backward movement in the femur.